Hi, my name is Zivia Kupker, and this is my presentation on attention deficit hyperactivity disorder, or more so known as ADHD. ADHD is a neurobiological disorder characterized by flighty attention spans and/or hyperactivity. In 1798, Scottish physician Sir Alexander Kitron described a condition similar to ADHD. He described an incapacity of attending with a necessary degree of constancy to one object. In 1936, the FDA approved benzodrine, which improved the focus of children in school. In 1956, the second edition of Diagnostic and Statistical Manual of Mental Disorders gave a name to the disorder, which was hyperkinetic reaction of childhood, which was later named Attention Deficit Disorder, or ADD, in 1980. In 1987, the condition was renamed Attention Deficit Hyperactivity Disorder and has been known as such ever since. Present day, research is being continued on ADHD to further understand the complications and what it means to have ADHD. ADHD is among the most common mental condition found in children. Students with ADHD are typically shown to do worse in school. Boys are typically diagnosed more than girls because of the different symptoms shown. Approximately 7.1 million in the US have been diagnosed with ADHD. 2.4% of young children 3 to 5, 11.5% of school-age children 6 to 11, and 15.5% of adolescent children aged 12 to 17. There are certain criteria according to the DSM-5 that a student or child must fall within to be diagnosed as ADHD. But there are three common types of ADHD that will help direct the diagnosis. There is predominantly inattentive type. People with this type of ADHD mainly struggle with attention and focus tasks. Um, in, in school, at work, they may not be able to focus on one task for an extended period of time. Following instructions or completing tasks can be found very difficult and even at times nearly impossible. Predominantly hyperactive impulse type, which is the second type, are those with this form of ADHD are characterized by hyperactivity and impulse actions. They are energetic and hyperactive, as the name indicates. Um, Things to look for are they may interrupt conversations, fidget, talk excessively, or act without considering consequences. The most common type of ADHD is the combined type, where you will have predominantly inattentive type and predominantly hyperactive impulse type all rolled into one. And you will see symptoms of both of these types in one person. In order to diagnose a child or adolescent or even an adult with ADHD, there are key diagnostic criteria. Symptoms must be present for 6 or more months and have a negative impact on everyday life. Children 17 years old or younger must show 6 of the symptoms. Adolescents 17 years or older must show 5 or more symptoms. Symptoms must be shown in 2 or more places like school, home, or church, or in some cases, all areas. This proves that the child is simply not just bored or acting out. Symptoms must not be explained by a better, different mental disorder. If the symptoms better fit for another disorder, there is no need to have an improper diagnosis or double diagnosis. The physiology of ADHD means the how does a person with ADHD look different to those who do not. How in this case there are no outward symptoms other than, or there is no outward um, changes. There is a difference in the brain. So we see this with neurotransmitters. Dopamine and norepinephrine are seen to be lower in children with ADHD. This leads to the lessening of the ability to focus and impacts impulse control, which creates the typical hyperactivity seen in children. Their brain structure um, is challenges in the lack of attention, inability to emotionally regulate, and difficulty decision making have shown to be a result of differences in the limbic system, frontal cortex, and basal ganglia. These parts of the brain are just seen to either be smaller or have abnormalities that are different to a quote unquote normal brain. The DMN, or default mode network, is the part of the brain that is active during daydreaming and is seen to be overactive in children with ADHD. This leads to jumps in focus that make it difficult for the child to stay on one subject for long periods of time. Overall brain size in children with ADHD has shown to have an overall smaller total brain volume than those who do not have the diagnosis. The areas of impulse control and executive brain functions are the main places seen to be smaller, like the limbic system, the frontal cortex, and the basal ganglia. There are three main treatments for ADHD, the first including stimulant medications. These medications are taken orally and serve the purpose of releasing dopamine and norepinephrine, which was talked about earlier for physiology. These neurotransmitters help in attention and executive processing. 70% of children see a reduction in symptoms, but like in all medication, there runs a risk of side effects. Behavior therapy is a different kind of treatment to medication. This treatment focuses on addressing negative behaviors and creating new behaviors that are healthier for the patient than those around them, than the ones they had in the past. The proper behavior is modeled for the patient. The patient will receive rewards for wanted behaviors and corrections for unwanted behaviors. The last treatment is neurofeedback, which I was not very aware of, but upon researching it and getting to know what neurofeedback was, I found it very interesting. It is a non invasive treatment that tracks brain waves of a patient through EEGs. Beta waves are produced when the patient is paying attention to the activity, and theta waves are produced during distraction. The patient's brain waves are viewed while doing an interactive cognitive activity. Once the patient loses focus or the theta waves are larger than the beta waves, the activity will not continue. So, for example, if a child is playing video games and they become distracted, the screen of the video games will turn off and they will be able to see on the EEG that the brain waves, the theta waves, are larger than the beta waves. So, this treatment allows for the patient to become aware of their own brain activity and see a physical representation of how their brain works. It promotes longer focus, self regulation, and impulse control. For most children, stimulant medications and behavior therapy combined see some of the best changes and the best outcomes. Notes for parents with an ADHD child. Create a consistent routine with clear expectations. Routine is good for everyone, but a person with ADHD, being on a schedule gives them clear goals and provide stability for every day. Encouraging physical activity, again, while good for everyone, they have an excess of energy that can be put towards physical activity rather than forcing them to sit there and be still while doing homework. So this may look like when they get home from school, they go play outside before doing homework. Breaking big tasks into smaller ones can help the task feel more manageable and help the child feel more successful while doing those tasks. Helping them create their own self-regulation skills is essential for any parent to do with their kids, but especially for a child with ADHD. They may not understand what it means and what it means that they're feeling or what they're feeling. So being able to explain to them and help give them ways to regulate their own self is really essential for them. One of the biggest things is advocating for them at school. Communicate the condition clearly and the severity of the condition because ADHD looks different in every child. The parent needs to know details about their child's condition in order to communicate effectively. Um, and then, as well as communicate the condition, you need to specify what needs your child may need. For teachers, um, essential things for the classroom that will help create a lighter environment and a more successful environment is rules should be posted, few in number, and stated in a positive manner. Having a physical representation on the blackboard or on the door will help the child see and remember rather than having to recall from memory. Having few rules in number is just easier for them to keep track of and doesn't seem like such a big thing to do. And then, of course, stating anything in a positive manner makes it seem less like a job or less like a punishment and more positive overall. Encouraging movement breaks for the whole class, not just for the ADHD student, will just help break up routine of sitting still and being and feeling like they can't move. So movement is very important. Giving transition warnings rather than an abrupt stops or switches can be difficult or abrupt stops and switches can be difficult for students with ADHD. Giving transitions allows them to have an end sight rather than just an abrupt stop. Breaking instructions into smaller steps can be very helpful and beneficial for a student with this condition. Rather than having 10 steps that they are focusing on, give them 2, let them complete it and feel successful, then move on to the next. Using visual aids and checklists allows students to learn how to manage their workload and time themselves. So if you have 4 things that need to be done in a day, writing those down on a board will help every student understand the goal for the day and be able to manage what their schedule needs to look like in order to complete that. Here are my references, and thank you so much for listening.